Good morning, everyone. Yesterday afternoon, or evening, I suppose, Donald Trump made this announcement, and I couldn't be happier.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died.
Okay, and so Donald Trump is suspending the funding of the WHO. He said, we give them hundreds of millions of dollars, and so we have a duty to ensure that they're basically doing a good job. And China gives them $40 million. Why are they carrying water for China, basically? So the defunding of the WHO matters because we sent them a couple of $1 million, I think between $2 million and $50 million, and it might be $52 million. I didn't have time to verify or check right now, but there's been funding packaged up in all of our COVID-19 money since the beginning of this crisis. Every single package passed by the House of Commons has had money going to foreign entities and the WHO. So this is interesting, isn't it? And I mean, 680 News is reporting this morning the WHO guidelines outline 6 areas officials must consider if they're to look at resuming activities. Here's where Canada stands on each of them. We're going to go through this, but not because I trust the WHO. Not at all, because they've been wrong on everything. Like in the early days, they said basically China's doing a good job, we're in containment, when clearly people were landing flights with sick people aboard, right? And Donald Trump said at the end of his presser, he stopped flights early and had a whole bunch of criticism for that. All through was called racist, xenophobic, blah, 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 blah. We're still landing flights, and don't worry, everybody, they're enacting stricter quarantine measures on returnees to Canada. So, I mean, it's very strange, very strange. But first, we're going to look at the WHO guidelines for lifting coronavirus restrictions. My question is, how quickly will Canada offer to fill the gap that Donald Trump just opened up in the WHO funding? Or will the WHO just fold back into the United Nations, and then will that entity also go bankrupt because Donald Trump refuses to fund that corrupt organization as well, right? I mean, they just put China on one of their major panels despite all of what's happening, right? Despite the fact that one way or another, a very deadly coronavirus got out of the city that has China's BSL-4 lab. And in compensation for that, they get put on a human rights or one of the major UN councils. And Canada is still running around trying to purchase a seat on a similar council. I mean, it just doesn't it makes perfect sense if you realize what the UN is and what it's trying to accomplish. Okay, back to this. The WHO issues guidelines. Federal and provincial officials are starting to discuss how and when to start reopening schools and businesses, but Prime Minister Justin Trudeau warned Tuesday the full-scale lockdowns most Canadians are living with right now will remain in place for at least several more weeks. If he said several more weeks, does he think we'll have a vaccine in several more weeks, or does he understand that the economy needs to open soon, regardless of vaccine or no vaccine? I think that maybe he's coming to realize that, if that's correct with the quote. Back to this. Similar discussions are happening around the world as many countries are starting to show some positive signs of slowing the spread of coronavirus, even as experts warn limited testing in most places could be masking the real picture of the disease. The World Health Organization is trying to inject some coordination into these decisions, releasing new guidelines Tuesday for what should be in place before easing restrictions. The organization that has been wrong all along and carrying water for China is now releasing the guidelines on how to open your economy again. Thanks, but Maybe we'll do this on ourselves. Back to this. Quote, the way down is much slower than the way up. Tedros Adhanom, I'm not going to try his last name because I'm just awful at it, so we'll just leave it at Dr. Tedros. Director General of the WHO said in a speech Monday, that means control measures must be lifted slowly and with control. It cannot happen all at once. We've got to do it carefully and with carefulness. And carefully. Okay, 1. Is transmission of the virus under control? No, not as far as we understand it in Canada, although the cases are declining. So maybe everybody sitting in their houses is having an impact. Probably is. Number 2, is the healthcare system equipped to detect, test, isolate, and treat every case and trace every person who came into contact with a positive case? No, and we haven't been doing that at all. That's not been, that hasn't, they've been telling us they've been doing this, but that's not been true. There are at least 50% of the cases right now in Ontario that they have community transmission, which means they don't know where the original person got it from, right? There was no travel or anything like that, so no, and no other infected people, right? So that's community transmission. That's somebody who was at the same hockey rink, not necessarily interacting with the same person, right? Number 3. Are outbreaks minimized in special settings like health facilities and nursing homes? No, those are actually where the hotspots are, right? Number 4, are there measures in workplaces and schools to prevent spread of the virus? No, and really, the mask thing is not mandatory, so that's true of everywhere. There are no real measures in place other than social distancing and washing your hands, so which is the same as the flu. Back to this. Are the risks of importing more cases from outside the country being managed? What? I thought this is definitely going to say no. It says, oh yeah, it totally is. It totally is. No problem, says 680 News. We're definitely not flying people in from sick areas, except that we are. So, I mean, I'm just showing you these six things to show you that the WHO is still out to lunch, right? Number 6, our local communities are educated, engaged, and empowered to adjust to the new norm. Short answer, maybe. Hey, whenever I see the new norm, I think to myself, propaganda, SpongeBob propaganda, right? And that's all this is. That's all this is. This is carrying water for the talking points that the WHO wants. And shocker, we're not ready at all, according to the WHO, to open up our economy. Not at all. And it doesn't have anything. What's missing on that list is, well, there's a lot missing on that list. I'm not gonna rhyme it off because I haven't given it enough time to expand in my head. So moving on. 680 News is also reporting government enacts stricter quarantine measures for returnees to Canada. So I was making the point yesterday that if you wanted to go outside of Canada, if you had another house maybe in somewhere else that was not as big of a hotspot, it would be very difficult potentially to do that. Are you on an essential visit out of your house, right? If you wanted to go on vacation right now, that's not a no-go. You couldn't go to the United States, and most people aren't traveling for work, etc. So Canadians can't move. We're in our house, right? Unless you are out for essential travel. If you want to go rollerblading with your kids in a parking lot, you might get a ticket. And that is scary. But people are still landing in Canada. And they're framing this as returnees. But, I mean, well, I've seen the Rebel reports. And who knows? Who knows what kind of citizenship situation those people are on? But are there that many Canadian citizens still left in China? If there were, wouldn't that be news? Wouldn't that be something like 8,000, 9,000, 50,000 Chinese Canadians still left in? No, that's not, and right? It's not happening. It's not news. So people are just landing from China into Canada. One example. New York is another example. Somebody sent me saying New York is the biggest coronavirus hotspot in the United States at this point in time, yet we're landing people with no checks. Here's a pamphlet. Please self-isolate. And now they're saying this. Starting at midnight, the federal government says all people returning to Canada will have to check into a hotel or other designated site unless they have an acceptable self-quarantine plan. The government says returnees, whether they have COVID-19 symptoms or not, must have an appropriate isolation plan that includes access to food and medicine. If a returnee lacks a credible plan, they will need to quarantine in a location such as a hotel designated by Canada's chief public health officer. The federal government will pay the bills for all such stays. So it's not even that if they don't do this, or if they can't do this, if there's no facilities for them to do this, if they don't have the money for them to do this, whatever, then the federal government will pay for your hotel stay. All expenses included. 14 days, there you go. No problem. No questions asked. Deputy Prime Minister Chrystia Freeland says the measures means returning Canadians will need to plan ahead of time. She describes it as an additional layer in Canada's protective actions against COVID-19. It seems like an additional cost when we could just say, don't come. We could just say, you're not welcome here unless you can meet these criteria. And if you can't meet these criteria, we're not going to pay for it. It just, right? It just seems like they're doing everything wrong. And it seems like they're purposely doing everything wrong. Well, they're purposely managing the country. And so their decisions seem wrong to me. So yes, they would seem to be purposely doing it wrong. Okay, Ottawa Citizen. Physical distancing loopholes need to stop, Ottawa health official says. This is just, it makes me sad and makes me laugh because this is a real newspaper and makes me laugh because it's incredibly arrogant to ask Canadians to do this. Here it is. If you've been enjoying a beer on your driveway with a friend or exchanging pleasantries with a neighbor over the garden fence, Ottawa's Associate Medical Officer of Health has a message for you. Stop it. Right? I expect the Canadian version of the Uncle Sam, right, to just jump out of your screen at you. It's crazy. Quote, back to the article. We're hearing about people who are looking for what I call loopholes, Dr. Brent Mulroney, Maloney? It's Maloney. Okay. Told reporters on Tuesday, according to an emergency order enacted under Ontario's Emergency Management and Civil Protection Act on March 28th, gatherings of more than 5 are prohibited with some exceptions. So if you're talking to your neighbor, if you count, that's probably less than 5, right? 2 of you, and I mean, gatherings of 5 people, but it just seems authoritarian to frame it the way they are. Anyway, back to this. The problem with beer on the driveway or chat over the fence is that it can turn into a parking lot or backyard party, said Maloney. Even if you have been technically observing physical distancing guidelines, there are still dangers to these situations, including the fact that some people who have COVID-19 do not exhibit symptoms. Okay, if you've been self-isolating in your house for the past month, like everybody else, and your neighbors have been kind of doing the same thing, the likelihood that either of you are infected is next to nil, is very, very small. So it seems, again, draconian to be expecting people to do this. Maloney urged residents to leverage, I scroll down a lot, to leverage social media to stay in contact with friends and family. Do you know what's interesting? I've heard a stronger call now for people to disengage with their phones like this. Because, well, how mindless is this, right? And I know Amazing Polly has been talking about this for 6 months. I'm potentially behind the curve, but is this what they're going for? I don't know. Get on your cell phones, everyone, so then we can turn it off and you can pay twice for it or something. I don't know. I don't know what the end game here is, but it seems really, really strange to tell people, get out of your backyard, stop talking to your neighbor, and get onto your cell phone. Right? It just seems weird. With everything these days, it just seems weird, right? And that's the Prime Minister. That's weird, isn't it? It's so weird. And people were enthusiastic, and people will be upset that I mentioned the fact that he's in blackface, and that's actually the same Prime Minister who's been calling Canadians racist, right? People get upset about that, and I think that it's they're not upset about the fact that he did it. They're upset about the fact that people talk about it. Weird, right? And to underline the fact that Justin Trudeau does not care about laws, not provincial laws, not federal laws, here's Anthony Furey, and I'm sorry if I've got his name wrong, and he is a columnist, op-editor for the Sun Papers Post Media, National Post host. And he says, to clear up any confusion, not only did Trudeau's Harrington Lake visit clearly break the spirit of the rules around cottage visits, it actually broke the law. Quebec passed new Ministerial Order 2020-13 banning access to Outaouais, sorry if I got that wrong, region to be precise. And I wanted to show you the law. Here's the law. It's the PDF. Link will be in the description. Ministerial Order 2020-13 of the Minister of Health and Social Services, dated 1st April 2020. And it says that access to the health regions of, and it lists a whole bunch of them. And here's the one that matters, right? Outaouais. Yeah, I'm saying that terribly. Will be restricted to the following persons who have their principal residence there. So Trudeau broke that. He doesn't live there, and he went there to visit his family. So despite telling everybody to not do that, right? You stop talking to your neighbor across the fence. That's dangerous. Don't you care about Canada? I mean, right? Trudeau doesn't. So when you start preaching at people, do as I say, not as I do, well, I mean, you start to look like this guy, right? Thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co, and have a wonderful, wonderful